Hello, my name is Carmine Vincent Lombardi, and today I'll be presenting you the strategic plan for the Proactive Health Department at Atrium Health. With Atrium Proactive Health, your local practice provides the kind of care you have come to expect from a doctor's office: annual physicals, wellness exams, sick visits, and a flu shot. However, with the premium $75 a month subscription, Atrium Proactive Health assigns its patients a doctor, a nurse, a dedicated health coach, and a registered dietitian. Patients are also provided free patient education classes on site and in the community, as well as a 90-day personalized health improvement program for hypertension, diabetes, and weight management. All the benefits of the Proactive Health program can be assessed and maintained via our proprietary smartphone app, consistently combining futuristic tech with tried and true evidence-based medical care. Atrium Proactive Health provides optimal services for the cost of a handful of fast food lunches a month. Why are these services outside of regular checkup a necessity? An average of 21% of people across North Carolina are currently in very poor or fair health, according to the Robert Wood Johnson Foundation. Conservatively, that means that 2.2 million patients now or in the near future will command a large percentage of the state's healthcare expenditures. Atrium Proactive Health is inclined to deliver these patients from their poor health states, saving their lives and their hard-earned money in the process. Atrium's Proactive Health program has a vision to show North Carolinians from all ages, all ethnicities, and all socioeconomic backgrounds that for a modest cost, Atrium's program ambassadors will work to combine medical care, fitness, nutrition, sleep, mindfulness, and social wellness to effectively achieve overall wellness. Atrium's mission and strategy is to instill proactive healthy behaviors in its patients. The Proactive Health Department at Atrium will be the source of a new program called Atrium Everywhere. Not only will AE be the name of Proactive Health's new program, but it will also share the name with its new Patient Health smartphone app. We believe that Atrium Everywhere will be the vehicle to delivering 21st century proactive care to North Carolinians. Headquartered in Charlotte, North Carolina, Atrium Proactive Health is a department that is proud of its slogan, Your Health, Your Way. Dedicated staff help individuals become healthier through exercise, education, and behavioral change. Atrium's team of exercise physiologists and physicians partner with patients to improve their quality of life through exercise, while also focusing on relationships, compassion, empathy, and connection. Our ambassadors have eclectic specialties, as seen here. Atrium Everywhere is equipped to tackle several key issues, the first being that almost a quarter of North Carolina's population is in poor health. That means that approximately 2.2 million people in the future will require greater future interventional medical care. That will be at a high burden for not only the state of North Carolina, but also for those individual patients dealing with out-of-pocket liabilities. The second issue is that a bulk of North Carolina's healthcare spending is on hospital care. This means that spending and the need for additional costly facilities will be needed if patients are not going to be conditioned to proactively monitor their health and to be focused on achieving wellness. The third issue is that tertiary care and acute care account for 70% of Atrium Health's healthcare expenditures. This limits the funds available to meet population health goals to affect future health behavior changes. And the last issue is that from 2010 to 2018, the population of North Carolina grew almost 10%. While healthcare data related to this portion of North Carolina's citizenry is limited, rapid population growth coupled with a possible downturn in levels of citizen health will require the expansion of Atrium Health's facilities. Situationally speaking, Atrium Everywhere is a program aimed at putting downward pressure on healthcare expenditures while putting upward pressure on general rates of patient wellness. Analysis of the external effects on Atrium Health has yielded two important findings on the economic front. The first being that North Carolina healthcare spending as a percentage of GSP is approximately 15%. A representation of the cost of interventional medicine, healthcare expenditures as a percent of North Carolina's GSP will only continue to grow if transformational change does not occur. The second, and positively, is that North Carolinians, according to the U.S. Bureau of Economic Analysis, are experiencing a strong 4.8% increase in personal income. That means that a greater degree of patient disposable income can go towards paying for a positive program like Atrium Everywhere. Of the social and technological external factors on Atrium Everywhere, one glaring technological factor is that providers must require meaningful use objectives to qualify for bonus payments. We believe that Atrium Everywhere will be a means through which providers can help patients meet certain population health goals, and that will in turn lead to greater incentive payments for payers. Following an internal environmental analysis of Atrium Health, we can highlight three important economic factors. The first being that 67% of Atrium's operating income was generated through the provision of tertiary care and acute care services. The second is that 52% of Atrium's expenditures are allocated towards wages, salaries, and benefits. And the third being that last year Atrium incurred almost $1 billion in unpaid Medicare costs. Two of the three highlight the disastrous effects again of interventional medicine and the costs associated with delivering that kind of care. The third, with respect to the wages, salaries, and benefits of employees, shows that Atrium does have the window to redeploy some of its assets into areas focusing on preventative care as opposed to interventional care. Internally, Atrium Health has made great strides in evidence-based medicine, particularly in the areas of procedures and technological advancements using the application of different apps, as well as in philanthropic work. Atrium's mission is to dramatically affect patients' lives by inspiring a proactive outlook on healthcare. Its vision is minimizing the patient population that is dependent on acute care interventions and maximizing the efficient and proactive maintenance and treatment of chronic diseases. Its values are wellness, compassion, economy, and equality. And finally, its goal is to enroll every Atrium patient into Atrium Everywhere. The development of Atrium's new product, Atrium Everywhere, is an adaptive strategy inclined to expand the scope and relevance of healthcare delivery in North Carolina. Taking advantage of the model pioneered by the Proactive Health Department, AE will be the institutional and marketing push to eventually enroll every Atrium patient into the preventative health program. The following figure contains a map of all of Atrium's hospitals located in North and South Carolina. Atrium is inclined to make large inroads into the health and fitness markets of North Carolina by creating a network of wellness centers modeled after our current center in Concord to function as area headquarters and coordination hubs for Atrium Everywhere. In planning the Atrium Everywhere strategy implementation, we must first look at the current situation of the Wellness Center in Concord. There we find that the capabilities of that wellness center are not being fully leveraged to not only inspire greater patient compliance and health, but we find that that wellness center is not being exploited to its full potential to gain a majority share in the Concord healthcare market. The desired situation that we would have for the wellness center is to increase its subscription rate by 25% in 1 year, and to have the wellness center play a pivotal role in the pilot year for AE, having it be a model for the delivery system for preventive healthcare program going forward. Next is to list what a strategy implementation for Atrium Everywhere would actually entail. The first objective would be to formalize the promotion of the Wellness Center in the exam room by making every provider check off that the Wellness Center was discussed with the patient in the EMR close encounter activity. Second would be to facilitate the direct communication of PCPs with the assigned patient nutritionist or activity coordinator via an in-basket message. With the capability, the wellness staff can share attendance, health data, and patient development directly with the physician to be subsequently reviewed by the PCP during patient visits. The third objective will be the creation of a comprehensive but concise electronic small form that wellness staff can compile, amend, and transmit to PCPs. This way, staff have a tool to adequately and accurately appraise patient health and advancement. The fourth would be the construction or repurposing of an unused space in the wellness center to construct a test kitchen suitable for teaching patients healthy and delicious meal and recipe alternatives. The fifth objective would be to utilize the Wellness Center test kitchen as a suitable interface space to incorporate the faith, community, and health ministry into the Wellness Center. This way, patients can be brought into the center for reflections in those studies rather than their place of worship, and have healthy eating and exercise instruction be conveyed or reinforced therein. Lastly, an aggressive local marketing campaign in supermarkets and health stores, on local transportation, and on social media. Social media promotions will be targeted towards patients in the Concord area. It will be targeted towards people searching health and exercise topics online. We believe that the total cost to retrofit and to market the Concord, North Carolina location would equal around $1 million. Slides 19 and 20 illustrate the implementation schedule for retrofitting and for marketing the Concord Wellness Center. We believe that an adequate measure of success will be the increasing of membership by 25% at the Concord Wellness Center. In the case that enrollment does not meet the 25% goal, Atrium would avoid unnecessary capital expenditures associated with building 5 additional centers, and instead it would carry out health planning and monitoring in Atrium physician practices and partner with local gyms to become Atrium Everywhere participants. By bringing Atrium to local facilities with which patients are comfortable, there may be an even greater propensity for patients to effortlessly incorporate preventative health behaviors to achieve lifelong wellness. One drawback associated with Atrium Everywhere's contingency plan would be that with the potential greater geographic reach associated with working with local gyms, Atrium will have to be more selective with its Atrium Everywhere participants. Otherwise, dispersing human capital across a large area may prove to be very difficult. Another drawback to Atrium's contingency plan is that greater geographic reach may give way to varying degrees of compliance amongst program ambassadors. Atrium Everywhere guidelines and benchmarks will have to be strictly enforced to maintain ambassador compliance. All in all, Atrium Health's Proactive Health Department is inclined to expand its services enterprise-wide with Atrium Everywhere. Combining existing proactive health examination methods, AE will look to transcend past the four walls of the exam room and inspire greater health compliance, better physical activity, and inspire healthy eating habits. The primary delivery system for AE will be Atrium's wellness centers. The pilot center for AE will be the Wellness Center in Concord, North Carolina. In order to prepare the Concord location to meet Atrium Everywhere's goals, the center will have to be retrofit and existing workflows will have to be amended. If the Wellness Center membership does not increase by 25% in the first year of Atrium Everywhere, the 5 additional proposed centers will not be built. And finally, if enrollment in AE falls under the 25% goal, a more grassroots approach can be taken and Atrium can enlist the support of local gyms as delivery systems for Atrium Everywhere.